AVN is an avascular necrosis. It's also known as osteonecrosis or aseptic necrosis. It's basically a condition that the blood supply to the hip joint gets cut off and then the bone dies. To this date, we still don't know the real cause and the real reason why people get AVN. We know that there are certain risk factors associated with getting AVN, such as alcohol usage, smoking, and corticosteroid usage, but we still do not know the real reason of getting AVN. Usually, the patient progresses all the way to the hip joint collapsing. At that point, there is no real treatment but putting a total joint arthroplasty, which is a metallic implant. Our treatment is very basic. We're going to be taking your own cells and multiplying them and eventually injecting back inside you and save your hip joint. Currently, the cost of putting total hip joint in patients in the United States is about $30,000 to $75,000. With our own method, we're going to be able to have the patients keep their own joint, and the cost is going to be a total of $10,000. The technology was invented in Ukraine, and it was first used on soldiers coming out of battlefield. And for these soldiers, the only option we're given was the amputation. Ilaya's technology led the patients to keep their own limb and legs. What we're going to do right now is we're going to utilize this technology on the civilian population that's suffering from the AVN disease. Currently, for the AVN disease, the treatment method is major operation and putting artificial hip joint. I have an MD and PhD in biomechanics. I have been working in the medical device companies past 25 years with different roles all the way from the R&D to FDA approval processes. My role with this ilaya medical technology is I'm going to bring in this technology to the US and establish it here and eventually go through the FDA approval process and get it approved in the US. Currently, we're seeking funds to bring this technology to the US and go through the FDA approval process. Once we have the FDA approval, we know that it's going to be easier for us to go any other country around the world.